12 natural approaches to lower creatinine levels and enhance glomerular filtration rate. Your creatinine levels and glomerular filtration rate, GFR, provide valuable insights into your kidney health. Abnormal results may indicate kidney problems. However, effective management strategies exist. This video presents 12 natural, doctor-approved methods to improve these vital kidney function markers. Whether you aim to address elevated creatinine, low GFR, or proactively maintain optimal kidney health, these practical tips empower you to take control. Discover powerful strategies to support your kidney well-being. 1. Stay hydrated. Kidney function. The kidneys filter blood, removing waste products such as creatinine through urine. With adequate hydration, the kidneys function more efficiently, effectively filtering blood and maintaining bodily equilibrium. The impact of dehydration. Dehydration leads to thicker blood, increasing the workload on the kidneys to filter waste. This can elevate blood creatinine levels and reduce the glomerular filtration rate, GFR. Benefits of adequate hydration. Lower blood creatinine. Hydration dilutes blood creatinine, reducing the strain on the kidneys. Improved GFR. Well-hydrated blood allows for easier kidney filtration, improving the GFR. Prevention of kidney damage. Maintaining optimal hydration significantly reduces the risk of long-term kidney damage. Recommended water intake. General recommendation: 8 to 10 glasses of water daily, 2 to 3 liters. Personalization. Individual water needs vary based on factors such as activity level. Increased water intake for those who are highly active or exercise regularly. Climate. Increased intake in hot, dry climates. And health conditions. Individuals with conditions such as heart failure or severe kidney disease may require adjusted fluid intake. Consult a physician for personalized guidance. 2. Adjust your diet. Diet plays a crucial role in kidney health, as your dietary choices directly impact the amount of waste your kidneys must process. Creatinine, a byproduct of protein metabolism, means that protein intake and other nutrients can either increase or decrease the strain on your kidneys. A well-managed diet offers a positive path towards supporting kidney health and function. Reducing protein intake, particularly red meat, offers significant health benefits. High protein consumption, especially from red meat, elevates creatinine levels in the blood due to the breakdown of protein into creatinine during digestion. Red meats such as beef and lamb are rich in creatine, which converts to creatinine during cooking, placing additional strain on the kidneys. Fortunately, a balanced approach is achievable. Substitute red meat with plant-based protein sources like beans, lentils, quinoa, soy products, and tofu. Leaner animal proteins such as chicken and fish can also be included, though moderation is advised for individuals with severe kidney conditions. This dietary adjustment promotes improved kidney function and overall well-being. Why limit sodium intake? Excessive salt consumption elevates blood pressure, potentially damaging blood vessels and nephrons, kidney filters, thereby reducing kidney function and increasing creatinine levels. The recommended daily intake is no more than 2,300 milligrams, 1 teaspoon. Individuals with kidney disease or hypertension should aim for less than 1,500 milligrams daily. Fortunately, healthier alternatives are readily available. Reduce your intake of processed foods, e.g. sausages, deli meats, instant noodles, and snack chips. Enhance the flavor of your meals with herbs and spices, garlic, turmeric, pepper, instead of relying on salt. By making these simple changes, you can significantly improve your health and well-being. Maintaining electrolyte balance is crucial for kidney health. High potassium levels can overwhelm the kidney's filtering capacity, potentially leading to strain and impacting the glomerular filtration rate, GFR. Conversely, low potassium levels can also impair kidney function and reduce filtration efficiency. Dietary management plays a key role. For individuals with advanced kidney disease, it's advisable to moderate consumption of potassium-rich foods, such as bananas, potatoes, tomatoes, watermelon, and squash. Fortunately, many delicious alternatives are available, including apples, strawberries, grapes, green beans, and broccoli, which are lower in potassium and support healthy kidney function. 3. Limit alcohol. While alcohol consumption is widely known to negatively impact the liver, it also exerts direct and indirect detrimental effects on the kidneys. The kidneys play a vital role in filtering blood and eliminating toxins from the body. Alcohol consumption increases the workload on the kidneys, demanding extra effort to process alcohol, thereby placing significant strain on the filtering system and potentially reducing kidney function. However, with mindful choices and a healthy lifestyle, kidney health can be maintained and protected. Alcohol's diuretic effect causes dehydration, concentrating blood and hindering kidney filtration, raising creatinine levels. High blood pressure, a common consequence of alcohol abuse, damages nephrons, reducing filtration. Excessive alcohol overwhelms the liver, forcing the kidneys to process toxins, leading to damage. Chronic alcohol consumption directly inflames kidney tissue, impairing nephron function and potentially causing acute or chronic kidney failure. Early intervention and responsible alcohol consumption can mitigate these risks. Take chitosan. Origin. Chitosan is a naturally occurring polysaccharide derived from the shells of crustaceans, such as shrimp, crab, and other shellfish. Applications. It is commonly used as a dietary supplement to aid in weight management and cholesterol control, and is currently under investigation for its potential benefits in supporting kidney health, lowering blood creatinine levels. Mechanism. Chitosan aids in the absorption and elimination of toxins, including creatinine, from the body via the gastrointestinal tract, thereby reducing the burden on the kidneys. Evidence. A 2011 study indicated that patients with renal insufficiency who received chitosan supplementation experienced a significant reduction in creatinine levels compared to the control group. Improving glomerular filtration rate. Mechanism. Chitosan helps reduce inflammation and damage to nephrons, the blood filtering units of the kidneys, thus improving the kidney's filtration capacity. By reducing creatinine and toxins in the blood, it lessens the strain on the kidneys, leading to improved GFR. Evidence. Clinical trials have demonstrated that chitosan not only lowers creatinine, but also enhances the kidney's blood filtration capabilities in patients with chronic kidney disease. 5. Increase fiber intake. Dietary fiber is a crucial component of a healthy diet, supporting not only digestive health, but also contributing to lower blood creatinine levels and improved glomerular filtration rate, GFR. This beneficial effect stems from fiber's ability to indirectly reduce renal stress by managing risk factors such as blood glucose, blood pressure, and systemic inflammation. Mechanism. Soluble fiber in food fosters a beneficial environment for gut microbiota. These bacteria aid in the breakdown and excretion of creatinine via stool, thereby reducing the burden on the kidneys. Evidence. A 2014 study demonstrated that chronic kidney disease patients consuming a high-fiber diet experienced a significant reduction in blood creatinine levels. GFR improvement via reduced inflammation and blood pressure. Mechanism. Fiber contributes to blood pressure control and inflammation reduction, both key factors influencing GFR. By maintaining vascular health, fiber supports renal blood flow, enhancing the kidney's filtration capacity. Evidence. Studies indicate that high-fiber diets reduce systemic inflammation, thus improving nephron function. 6. Exercise regularly. Regular exercise is not only beneficial for overall health, but also plays a crucial role in maintaining and improving kidney function. Exercise enhances blood circulation, helps control blood pressure, reduces inflammation, and aids in weight management, all of which contribute to more efficient kidney function. Mechanism. Exercise enhances renal blood flow, improving blood filtration and creatinine clearance. Furthermore, exercise promotes more efficient energy utilization, reducing creatinine production. Benefits. Improved renal blood flow directly enhances creatinine filtration, leading to lower blood creatinine levels. Enhanced GFR through blood pressure control mechanism. Regular exercise effectively manages blood pressure, a critical factor in kidney health. Stable blood pressure protects nephrons, the kidney's filtering units, from damage, improving GFR. Benefits. Improved GFR signifies the kidney's enhanced ability to filter blood efficiently. Reduced inflammation and oxidative stress mechanism. Moderate intensity exercise helps lower inflammation and oxidative stress, two factors that damage the kidneys. Benefits. Reduced inflammation protects against kidney dysfunction, indirectly improving GFR. 7. Manage blood pressure and blood sugar. Uncontrolled high blood pressure and blood sugar are two leading causes of kidney damage. However, with proper management, the risk of kidney damage can be significantly reduced. Effective control of these factors helps maintain the kidney's ability to filter blood, preventing elevated creatinine levels and decreased glomerular filtration rate, GFR. While long-term damage from hypertension and diabetes can contribute to chronic kidney disease, CKD, and ultimately kidney failure, proactive management offers a positive outlook and the potential to significantly improve kidney health and overall well-being. Mechanism: elevated blood pressure exerts pressure on the small blood vessels within the kidneys, nephrons. Over time, this pressure damages the nephrons, reducing their blood filtering capacity. Consequently, creatinine is not effectively filtered, leading to elevated blood creatinine levels and reduced glomerular filtration rate, GFR, as the kidneys cannot perform their filtering function optimally. 2. Hyperglycemia. Mechanism: high blood sugar damages the kidney's blood vessels and tissues, impairing nephron function. Excess sugar in the blood creates inflammation and oxidative stress, contributing to kidney function decline. Consequently, there's an increased risk of diabetic nephropathy, resulting in decreased GFR and increased creatinine levels. However, with proper management, these negative effects can be mitigated, preserving kidney health and function. 8. Reduce stress. Stress significantly impacts kidney health through both direct and indirect mechanisms, affecting not only mental well-being, but also physical health. Prolonged stress triggers the release of stress hormones like cortisol and adrenaline, leading to elevated blood pressure and glucose levels, and reduced renal blood flow. These factors compromise kidney function, potentially resulting in elevated creatinine levels and decreased glomerular filtration rate, GFR. However, understanding these connections allows for proactive management and mitigation of these risks. Hypertension due to stress. Mechanism: stress activates the sympathetic nervous system, causing vasoconstriction and increasing blood pressure. Elevated blood pressure damages nephrons, the blood filtering units in the kidneys, leading to reduced glomerular filtration rate, GFR, and increased creatinine levels. Consequence: prolonged hypertension damages the small blood vessels in the kidneys, impairing renal function. Hyperglycemia. Mechanism: during stress, the body releases cortisol, increasing blood glucose to meet energy demands. High blood glucose can damage renal blood vessels, reducing filtration efficiency. Consequence: this increases the risk of diabetic nephropathy. Reduced renal blood flow. Mechanism: prolonged stress causes vasoconstriction, reducing blood flow to the kidneys. This diminishes the kidney's ability to filter creatinine and other waste products, leading to elevated blood creatinine. Consequence: decreased GFR indicates impaired renal function. However, with proper management of stress and underlying conditions, kidney health can be preserved and improved. 9. Lose weight if needed. Weight loss not only improves overall health but also offers significant benefits for kidney function. Being overweight or obese increases the risk of hypertension, diabetes, and cardiovascular disease, all major contributors to kidney damage. Losing weight reduces strain on the kidneys, improves glomerular filtration rate, GFR, and lowers blood creatinine levels. This contributes to better kidney health and overall well-being. Mechanism: excess weight increases vascular resistance, leading to hypertension. Hypertension damages nephrons, the blood filtering units in the kidneys, reducing the glomerular filtration rate, GFR, and increasing creatinine levels. Insulin resistance and hyperglycemia. Obesity is frequently associated with insulin resistance and hyperglycemia, which damage the renal vasculature. This impairs kidney function, reducing creatinine clearance. Chronic inflammation and oxidative stress. Excess body fat triggers inflammatory responses and oxidative stress, damaging the kidneys and reducing their filtration efficiency. However, addressing these underlying conditions offers the potential for improved kidney health and function. 10. Avoid nephrotoxic substances. The kidneys play a vital role in filtering blood and eliminating waste products from the body. While some medications, supplements, or chemicals may potentially impact kidney health, especially with frequent use or high doses, the body possesses remarkable resilience. These substances may temporarily reduce the glomerular filtration rate, GFR, and elevate creatinine levels, but with appropriate management and lifestyle adjustments, kidney function can often be preserved or even improved. Mechanism: Nephrotoxic substances can damage the nephrons, the functional units of the kidneys, leading to inflammation or structural destruction. Consequently, the glomerular filtration rate, GFR, decreases due to impaired kidney filtration, resulting in elevated creatinine levels as waste product clearance slows. Increased renal workload. Nephrotoxic substances increase the burden on the kidneys as they work to eliminate these toxins. This increased workload can lead to renal overload and, over time, a decline in kidney function. However, with appropriate management and treatment, kidney function can often be preserved and improved. 11. Use herbal remedies. Traditional herbal remedies have long been utilized to support kidney health. Certain herbs offer several benefits, including enhanced excretion of waste products, such as creatinine via urine, improved renal blood flow, and a reduction in inflammation and oxidative stress, key factors contributing to nephron damage and decreased glomerular filtration rate, GFR. Mechanism. Certain herbs possess natural diuretic properties, increasing urine production and assisting the kidneys in eliminating creatinine and other waste products. For example, nettle leaf is known to promote urination and reduce creatinine levels. Inflammation reduction and nephron protection. The anti-inflammatory compounds in these herbs help minimize kidney tissue damage and protect nephrons from functional decline. For instance, cinnamon contains anti-inflammatory and antioxidant properties, supporting blood flow to the kidneys. Fenugreek seeds offer anti-inflammatory benefits and help regulate blood sugar, reducing strain on the kidneys. Nutritional balance. Some herbs help maintain electrolyte balance and reduce the filtration load on the kidneys. For example, dandelion root is naturally rich in potassium, supporting kidney function. However, caution is advised for individuals with chronic kidney disease. 12. Drink the right amount of water. Water plays a vital role in ensuring optimal kidney function. The kidneys require adequate hydration to effectively filter blood, eliminate waste products such as creatinine, and maintain the body's electrolyte balance. However, both insufficient and excessive water intake can negatively impact kidney health, potentially affecting the glomerular filtration rate, GFR, and blood creatinine levels. Maintaining a balanced fluid intake is key to supporting healthy kidney function. Mechanism. Dehydration concentrates the blood, increasing the pressure on the kidneys during filtration. This reduces creatinine clearance, elevating blood creatinine levels. Consequently, reduced GFR indicates impaired kidney function and increases the risk of nephron damage due to decreased renal blood flow. Conversely, excessive hydration. Mechanism. Overhydration dilutes blood sodium, hyponatremia, causing electrolyte imbalance and unnecessary strain on the kidneys. Consequence: the kidneys work harder to excrete excess fluid, potentially leading to long-term damage in individuals with compromised renal function. However, maintaining proper hydration is key to supporting optimal kidney health. Maintaining kidney health is crucial for overall well-being. These 12 natural strategies offer effective support for optimal kidney function and improved health. Embracing these tips will contribute significantly to long-term kidney health. We encourage you to begin implementing these recommendations today. For continued access to health-enhancing information, please like, subscribe, and enable notifications. We welcome your comments regarding your chosen initial strategy and look forward to your participation in our next video.